Hello, this is a virtual microscopy slide of a case of Burkitt lymphoma of the small bowel, and we can see here two sections of small bowel. This whole area in the center is involved by lymphoma. Let's have a very quick look at the uninvolved small bowel. Here is the mucosa of the uninvolved small bowel. This is the muscularis mucosae. This is the submucosa. And deep to this here, this pink layer is the muscularis propria. The mucosa of the small bowel is composed of villi, so we see these finger-like projecting structures, and they are lined by columnar cells with occasional goblet cells. And within the lamina propria, we can see usually some plasma cells and also some lymphocytes, but they do not expand or fill up the whole lamina propria. These are the crypts within the mucosa. Going back to low magnification, we can see that in this area, the mucosa starts to become very blue in color on low magnification, and this is because the lamina propria is full of abnormal lymphoid cells. Over here, the abnormal lymphocytes involve the mucosa, the submucosa, and we can see that they are also extending into the muscularis propria. So this lymphomatous infiltrate involves nearly the full thickness of the small bowel wall. Let's take a closer look at the malignant lymphoid population. At this magnification, we can see what we call a starry sky appearance, and you can see these paler cells that are just sprinkled among a very blue background of lymphoma cells. These paler cells are actually macrophages, and they are called tingible body macrophages. We can recognize that they are macrophages because they are large, much larger than the surrounding lymphocytes, and the nucleus is very clearly seen here with abundant cytoplasm. Within the cytoplasm of these tingible body macrophages, we can see some of these inky, blackish-looking bodies. And over here is another example of a tingible body macrophage. We can see these small rounded bodies within the cytoplasm. These are the so-called tingible bodies, and they are engulfed material from the surrounding dead tumor cells. Here again we can see the tingible bodies within the cytoplasm of this tingible body macrophage, and usually in tumors with very high turnover of tumor cells, where the tumor cells grow and then die very quickly, and there's lots of dead tumor cells, this is where we will see abundant tingible body macrophages, and Burkitt lymphoma is a very rapidly growing lymphoma, hence we have lots of these macrophages. Over here, we can see the malignant lymphocytes more clearly, and many of the cells appear very monotonous. They have round nuclei that are pretty much the same size. Usually when we see a monotonous lymphoid population, this is a worrying sign that we are likely to be dealing with a lymphoma. So many of the nuclei are round, they are medium-sized, and we can see that there are small nucleoli, and many of the nuclei actually contain several nucleoli. For example, we can see 2 in this cell, and in this cell we can see 1, 2, 3 nucleoli. Another feature of Burkitt lymphoma is the presence of many apoptotic bodies, as mentioned, because of the high growth rate. So we can see here some apoptotic bodies here, and there are also many mitotic figures. It is not very clearly seen here, but this is possibly a mitotic figure, and another one here. And the rapid growth is also reflected grossly as a very rapidly enlarging tumor mass. Let's learn a bit more about Burkitt lymphoma. Burkitt lymphoma is an aggressive non-Hodgkin B-cell lymphoma that is often associated with EBV infection, and it is due to the c-Myc gene rearrangement, which causes constitutive activation of the c-Myc gene and therefore promotes cell cycle progression. The commonest translocation is the translocation between chromosomes 8 and 14. There are three epidemiologic subtypes. The endemic subtype, which is usually found in Africa and causes Burkitt lymphoma of the jaw. The sporadic subtype, which we see here, and this is more likely to give rise to gastrointestinal tract involvement. And there is also an immunodeficiency-related subtype that is seen in HIV patients. There is a separate video describing the gross pathologic features on this virtual gross pathology specimen, and this can be found together with the specimen in our free online pathology resource, Pathweb. The registration link is in the video description. Burkitt lymphoma is a highly aggressive lymphoma, but it generally has a good prognosis, particularly in developed countries, because it is very sensitive to chemotherapy, and survival can be as high as 90% in children at the 5-year mark. Grossly, we will see an ill-defined pale tan mass which expands the wall of the small bowel, and this has a very homogeneous or so-called fish flesh appearance. On microscopy, as demonstrated, we see these sheets of monotonous medium-sized lymphocytes, and we often have this starry sky appearance due to tingible body macrophages. This is an area where the small bowel is not involved by lymphoma, and over here we can see that there is lymphomatous involvement in the mucosa and submucosa, and over here the lymphoma cells involve the mucosa, submucosa, and the muscularis propria. So they appear as these very ill-defined sheets of lymphocytes. And on high magnification, the lymphocytes have round nuclei with several small nucleoli. There are usually numerous mitotic figures and also many apoptotic bodies. Hence, in summary, this is an example of Burkitt lymphoma of the small intestine where we have a diffuse, ill-defined infiltrate of neoplastic lymphocytes almost through the full thickness of the small bowel wall. This tumor often is associated with a starry sky appearance, the stars in the sky being the tingible body macrophages that engulf apoptotic bodies. And the tumor cells are medium-sized with very monotonous rounded nuclei with several nucleoli. This is a highly aggressive tumor. However, it is extremely sensitive to chemotherapy and hence has a good prognosis. Thank you.